Elbow tendinosis is non-inflammatory angiofibroblastic hyperplasia with mucoid degeneration of common flexor or extensor origin. This video is showing the etiology, accurate diagnostic, and treatment modalities. Epicondylosis is common and debilitating cause of elbow pain. It is commonly recognized as an occupational disorder involving repetitive overuse of hand, wrist, and forearm. For detecting this condition, we need proper eyes for physical evaluation and imaging studies. Let's start with lateral. Actually, extensor carpi radialis tendinosis. The cousin test is indicate lateral tendinosis. The physician immobilized the elbow with one hand while the other hand lies on the dorsum of the patient's waist. The patient then requested to extend the wrist against the resistance. Localized pain in the lateral epicondyle or pain in the extensor compartment suggests disorder. The chair test is useful test for work activity. The tendinosis patient shows occurrence of or increase in pain during chairlifting test. The patient is requested to squeeze together a blood pressure measuring cuff inflated to about 30 mm mercury held in his hand or squeezing the cuff. Occurrence or increase in pain over the region indicate positive finding. The flexor of the forearm and hand and the pronate teres have their origin on the medial epicondyle. The pain over the medial epicondyle by reverse quadrant test suggests tendinosis. We can have a visible finding by radiographic, ultrasound, and MR imaging. The calcification around the tendon indicate chronic overuse or steroid injection. The MRI study provides excellent information both intra-articular pathology and tendon integrity. Ultrasound examination is useful test for detecting elbow problem and it contains dynamic real-time data. The initial management of this tendinosis is start with physical exercise. Then we are going to more and more invasive modalities. Flexor and extensor stretching exercise is favorable manner for obtaining flexibility, which is main component of curing mechanism. This counterforce type of brace inhibit full muscular expansion and thus decrease the force experienced by sensitive or injured muscular tissue proximal to the band. The injective management is usually focused on anti-inflammatory or promote healing mechanism. For this purpose, we could select one of those following the condition and disease stages. This is 15-year-old basketball player. I inject the autologous blood into his medial epicondyle. The final intractable cases, we also have a knife for eliminate the sores. Not same as easygoing open surgery, the arthroscopic procedure requires proper joint distension. The main procedure is debride the degenerative region for remove the painful tissue and promote healing. During the procedure, we should not forget where is the tissue region. Why? The main reason of the failed surgery is by the wrong surgical location. Here is the lateral epicondyle and showing debridement of condyle. The final stage of the surgery is hemostasis. The patient requires 3 days of protection by dorsal splint. In summary, first step for the management of elbow tendinosis is thorough examination. Also, well-trained non-operative modality is enough for more than 90% of the patient. Finally, if surgery is inevitable, we should not miss the surgical focus. Thank you.